Hello, I'm Ron Gruber, and I'm here today to tell you a little bit about a procedure called Septoturbinotomy. This is a procedure that my colleagues Neil Tanna, Tim Abusayed, and Mal Lesavoy have been working on for the last several years in an attempt to avoid a more open, direct surgical approach to bone removal of the turbinates and septum. It's a simple, quick maneuver that we think you will find very helpful. Let me demonstrate in this slide that the speculum, a long and wide speculum, is inserted all the way into the vestibule, and once it's in there, the speculum is opened, causing a fracture of the bones and a widening of the space. Now, it is not done if you're interested in harvesting septal cartilage, because it might cause some fracture of the cartilaginous component. But otherwise, it's used by us all the time in virtually all cases, and we experience essentially an overwhelming majority of patients obtaining a wide open airway in this portion of the nasal cavity. Let's look at the video. The speculum is put in to first allow local anesthesia. This should be done at least 7 minutes beforehand to the turbinates and the septum to avoid any bleeding that would occur otherwise. Now here's the speculum put in on the left side. The blades are spread apart. There's typically a crunching sound that causes the bony septum to centralize, and it causes the turbinate to outfracture. I'm doing the other side now so that both sides are done equally, causing the septum to tend to assume a central position. In the event you want an even more open airway, a speculum can be inserted with a fulcrum as placed on the anterior nasal spine, prying outward to outfracture the turbinate even a little more. That's the entirety of the procedure. It's quick, simple, and fast, and as I said, it works in the overwhelming majority of cases, causing us to seldom have to go in and actually remove bone from the septum, and even more infrequently to have to do a formal turbinectomy. Let's go to the cadaver lab, because my authors, my colleagues, and the residents in the past have examined what actually happens in the cadaver model. On the left, you see that the turbinate is located practically in the middle of the airflow, and the bony septum is somewhat crooked. But by putting a speculum in there, which was done, and fracturing the bones on both sides, you can see that on the right side, the result is that the turbinate is now collapsed, and the bony septum, although not perfectly straight, is straighter, and it is centralized, which is all we really want. And this occurs in the overwhelming majority of cases. So in summary, we suggest that if you haven't tried it already, you may find it a wonderful way of performing a non-invasive technique to open up the airway by outfracturing the turbinates and centralizing the bony septum. If you want, you can use a large clamp instead of a speculum, as my colleague Mal Lesavoy uses. If you want, at the end of the procedure, you can put some tubing in the nose in order to maintain the airway in its open position. I personally use a Doyle splint. Whatever you choose will certainly work quite well. The bottom line is that a simple dilation of the cavity works in the vast majority of cases, and the only time we have to worry about it is when we're harvesting significant portions of cartilage and we don't want to risk fracturing that cartilage. Otherwise, it's been extremely wonderful in our hands, and we hope you find it to be the same. Thank you.